Please, can you see me now? Okay. So as I was saying, we have Pluto's hand, very beautiful hand. So Pluto's hand is here, a stamp, everything is here. We have nice bone, beautiful bone inside. Now, on the bones, we have muscles, okay? Muscles that are attached to the bones, muscles. Very muscular human being, okay? Muscles that are attached to the bone and all that. Now, together with the bones and the muscles, we have white blood cells. We have blood vessels. So let me use red. You have blood vessels. I don't know whether this is red or whatever. We have blood vessels circulating within the hand. Okay. Now, we have a group of white blood cells like your macrophages, the mast cells, the monocytes, and co. They classically live within the tissue spaces. So let me use another color. The macrophages and the mast cells, they are within the tissue spaces. They are within where? The tissue spaces. They are within the tissue spaces like this, and like that, like that. And then we have the neutrophils, who are the major actors of inflammation. We have them also residing in the blood vessels. So we have neutrophils being circulated within the blood cells. So these are the white blood cells, the neutrophils that are being circulated by the blood vessels. Please, do you see my screen? So the neutrophils are being circulated by the blood vessel. The macrophages and white blood cells, they are living within the tissue spaces. So now, let's assume Pluto was playing football. He was a keeper. And then, as he dived, there was some stone somewhere. And then that stone just cut like this. And then he started bleeding. And as the injury was there, some dangerous bacteria had a chance to what? Enter his tissue spaces through the cut in his skin. Now, as soon as this bacteria gets into Pluto's muscle tissues, releasing toxins, they will attempt to release toxins to kill the body's natural cells. With that process, as they release their toxins, these mast cells, these macrophages, and other senior white blood cells will detect that there are bacteria around. So they will release the mast cells amongst them will release the histamine to the endothelia of the blood capillaries. Then they will set the stage for what? Vasodilation, vasoconstriction, and then the inflammatory response will happen. Before the neutrophils, which are the major actors in acute inflammation, will also be now what? Recruited to the site through the stages and the methods that we have been discussing all along. If you understand, show me some emojis so that I'll get a response from you. I see, you understand. That's nice. Okay. So we also have serotonin, and this is those of you who are fans of biochemistry. This is the chemical symbol. This is the chemical symbol for serotonin. So you have some amino acid inside. I don't know whether it's arginine or phenylalanine or whatever. I don't want to concern myself with these things. So yeah, tryptamine. This thing tells you that it's amino acid, and they are produced by platelets and enterochromaffin cells. They also cause vasodilation, but it is not as direct as that of the histamine, and they cause the production of an enzyme, a group of enzymes which are called synthetase. Okay, synthetase, which is a ligase. When we say something is a ligase, it's an enzyme that causes ligation. It causes the binding of what? Two different biomolecules, ligase. And according to our source, this ligase is produced from arginine. That is not our problem. What you are supposed to know is that serotonin is a vasodilator, an indirect vasodilator, and causes the production of nitric oxide synthetase. All right. We also have the kinin system. And after vasodilation has happened, you know that the next step is for what? Increased permeability to what happened. And so the main chemical mediator that causes the increase of what? Increase of the endothelial permeability, vascular permeability, is what we call the kinin. So we have bradykinin, which is the key. Another kinin, you see their names and then you have kinin on it, or maybe bradykinin 1 or 2, or they have a way of naming them. That is not our concern over here. They are sometimes produced by what? Other cells like endothelia and other cells. They are also produced by the liver. Categorically, they are released into what? The plasma. Their action is, of course, increasing permeability, and then also smooth muscle contraction. They are not vascular. They are not produced by from the liver. And they are. So why do you think that smooth muscle contraction is important? Of course, if the smooth muscles contract, we have smooth muscles in blood vessels. You understand? We have smooth muscles in blood vessels. So with their contraction, we are going to stretch the capillaries. Stretch the capillaries to what? The intercellular spaces between the endothelia, so that water and the liquid components of plasma and the plasma proteins can exudate into the extracellular tissue spaces. And some of the effects of kinin is the pain. So we mentioned that inflammation has cardinal characteristics: pain, heat, redness, edema or swelling, and then loss of function. So this kinin system is one of the key causes of pain, probably due to their action on what nerve endings within the area of inflammation. We also have clotting factors. Clotting factors. Why do you think that clotting factors are even important? So we mentioned that when there is an injury, there is vasodilation. That vasodilation is an effort of is an effort of the body system, the organs, the organism, to slow down the speed, the hydrostatic pressure with which blood is what circulating. You want to slow down the speed at which white blood cells and other plasma proteins enter the area of inflammation, leave. So we want to give them some kind of break. So the blood has to become coagulated. It has to become thicker so that we can slow it down. Okay, so these clotting factors are major and important chemical mediators, which cause the production of what? Fibrin. Fibrin. Okay, fibrin is a very important protein that creates that meshy thing. When you learn blood clotting, you see that the fibrin is converted to one other chemical, and then they create the mesh. Then we have the platelets in it to stop bleeding. So this fibrin, when it creates that meshy consistency of the blood, it creates the coagulation of the blood. It makes the white blood cells difficult for them to pass from wherever the inflammation is happening, so that they can concentrate. They can be plentier there. Their number, they will proliferate over there to be able to go their transmigration. Fibrinolysis is the process by which the fibrin is what? Broken down. Fibrinolysis, probably after the inflammatory response has ended. We also have eicosanoids or arachidonic acid derivatives. These are produced by breaking down part of what? Cell membranes. So we mentioned that the cell membrane is a lipid bilayer. So yeah, lipid bilayer they have the phosphate head, lipid tails, and all that levels. So during inflammation, part of the body's the cell membranes are broken down into what we call arachidonic acid derivatives, and then they are used to produce these prostaglandins, leukotrienes, and lipozymes, and all of them are part of what? The chemical mediators. Prostaglandins, they also cause pain, they also cause heat. So when the prostaglandins get into the system, like the blood vessels, and they get into circulation, they also, that is what generates the fever that people have when there is either an infection or some pain somewhere in their body. You also have the leukotrienes and what have you. Please learn about them. So as I said, the prostaglandins, they cause what? Pain, fever, and then clotting. So blood clotting, not like forming something like a total clot or something like a thrombus or an embolus that will go and harm the body per se. But the blood thickness has to increase so that they can have a higher viscosity, so that blood doesn't just flow through the dilated capillaries at that same hydrostatic pressure as before. The blood has to slow down so that we can accumulate more white blood cells to transmigrate and go and initiate the inflammatory to continue the cellular part, the cellular event of the inflammatory response. So we have leukotrienes here. They are responsible for what? Chemotaxis. Of course, we know that we need chemotaxis so that the white blood cells, after they have transmigrated from the vascular system into the tissue system, we need these leukotrienes. They need to be able to know the direction which they should go, so that they can go to the place of what? Insult. They can go to the place of insult, whether it's an infection that is causing the insult, or some cut or some necrosis that is happening. So it is the leukotrienes that cause what? The chemotaxis, and also vasoconstriction, and also play roles in increasing the permeability. All right. Please, do you have any question? If you have any question, kindly. Oh, please go over again. Okay, I think they are talking about the prostaglandin time. So let me go back. So I said that we have prostaglandins, and they are part of what we call eicosanoids. Okay, eicosanoids are produced through the arachidonic acid pathway. You can read around that arachidonic acid pathway, and they are synthesized by what? Using parts of cell membranes, the phospholipid bilayer that makes up the cell membrane. So these eicosanoids, examples of them is what we call prostaglandins. We also have leukotrienes and lipozymes. And as I said, these biochemical elements, they are important so that in the process of the inflammation, one particular event can transition into another. Okay, one particular event. Let's say we can get transition from vasodilation to, let's say, transmigration. Between the various sub-events of inflammation, we need these chemical mediators to act on the inflammatory major actors, like the leukocytes and then the endothelial tissues, so that they can move on to the next stage of the inflammatory sequence. You see, the inflammation is a sequence of events. So for us to get from one event to another, there has to be a chemical mediator acting on either the endothelial cells or the leukocyte, the white blood cells. So prostaglandins, they cause what? Clotting. And I said, why do we need clotting? We need clotting because it is when the blood clots, or when the blood becomes more viscous, when the thickness or consistency of the blood becomes thicker, that is when blood movement through that vasodilated segment of capillaries where the inflammation is happening, that is where the blood will slow down so that we can accumulate more plasma proteins, we can accumulate more white blood cells to undergo what? To carry on with the inflammatory response. Otherwise, even though there is vasodilation, the hydrostatic pressure of blood will still remain the same, and then you wouldn't be able to recruit any necessary plasma proteins and leukocytes to carry on with the inflammatory process. Please, do you understand? Dennis, do you understand? Okay. Then also we have these leukotrienes. They help in chemotaxis, vasoconstriction, and increased permeability. And we know why we have to have all of these events. We know why we need chemotaxis. We know that chemotaxis is important so that when the white blood cells get into the tissue spaces, they will know where to go, where the insult is happening, where the bacteria is, where the tissues are dead, the necrosis, so that they can go and what? Either fight against whatever infection is there or whatever dead tissues are there. You understand? That is the role of chemotaxis. It gives the leukocyte a direction, because the tissue spaces is a big place. The tissue place is a big place, and the inflammation is not necessarily happening everywhere. So it is these leukotrienes that give the track for the leukocyte, the white blood cells, the neutrophils, to know where to go and find the bacteria or any bad guy, any foreign agent that is causing havoc. Aside the chemotaxis, they also cause vasoconstriction, and they also cause increased permeability. Vasoconstriction, we learned that when there is an inflammatory, when there is an injury, the first response of the vascular system, which is also very short-lived and transient, is that there is a quick vasoconstriction before we get to the vasodilation. You remember. And of course, the vasodilation will cause the increased permeability. Then we have these lipoxenes. For them, what they cause, their release will inhibit chemotaxis. Okay, the release of these lipoxenes will inhibit chemotaxis, and that should tell you that they are released. Some of them are released at the end of the inflammatory response, so that more neutrophils wouldn't be recruited to the site that had previously been inflamed. Please do understand. Because if the inflammatory response is ongoing and there needs to be more neutrophils to go and clear the agent of the insult, and as the body is producing the leukotrienes, another part of the body is producing the lipoxenes, you see that their effect is going to what? Cancel out. So when the inflammatory process is active, we have the leukotrienes. They have their own names, maybe interleukin this, interleukin that. Now, after the inflammatory response has resolved, then we are going to release what? The lipozymes, which is going to inhibit chemotaxis. And the inhibition of chemotaxis, what is it going to cause? It is going to cause a stoppage or a halt. It's going to cause a halt to the increasement of what? More leukocyte, more neutrophils. Please do you understand? In other circumstances too, they are causing vasodilation, and that's what I was saying. And my attention had not even been drawn to that. They counteract the actions of what? Leukotrienes. So the two of them shouldn't be at the same place. They shouldn't be released at the same time because their actions are contra. They are anti one another. I hadn't even seen it. But you see, their actions are contra one another. So leukotrienes are important when we want to recruit more what? When we want to more recruit recruit more neutrophils. And then after the inflammatory response has resolved, then we are going to produce more lipozymes so that they are going to inhibit the chemotaxis so that we don't get any additional neutrophils at the site of inflammation. Because mind you, when these neutrophils come to the site of inflammation, they are not only killing bacteria or removing necrotic cells, their action also cause collateral damages to other standby normal cells. Okay. We also have platelet activating factors. And what do you think they will do? What do you think the platelet activating factors will do? They are also going to, at the end, cause what? Blood clotting, or increasing the consistency of they are going to increase the viscosity of blood. And if there is any injury to the blood vessels due to probably diapedesis, or there was any direct injury to the blood vessels, the platelets, after they are being activated by the platelet activating factors, are going to what? Plug, so that there is not going to be bleeding and continuous exudations. Please, are you with me? Let me see some emojis to see your responses. And let me know too if you can hear me very well or I need to speak up more. All right, let's continue. Then there is also a group of chemical mediators. So the prostaglandins, the leukotrienes, and the lipozymes, remember that they fall under um, a group of chemical mediators called Eicosanoids. I don't know how you pronounce them, whether it's Eicosanoids or whatever, or Eicosanoids. So we have three of them that we have discussed. We have the prostaglandins, the leukotrienes, and the lipozymes. Then another group is the cytokines. The cytokines, also called chemokines, they are proteins. They are proteins and they are produced by many cells, but usually they are produced by lymphocytes and macrophages. And they play numerous roles in acute and chronic inflammation. What did I tell you? I told you with Pluto's example that these lymphocytes and macrophages, they are mostly within the tissue spaces. So they are the ones that recognize the whatever injury or bacteria first, and then send other chemical mediators to go and what activate and initiate the inflammatory process. Initiation. So major examples are the tumor necrotic factors, then we interleukin 1. Okay, I think we have heard a lot about these two chemicals, tumor necrotic factors and then interleukin 1. These two are produced by what? Macrophages. So that is for the cytokines. Then we have chemokines. They are smaller proteins and they are attractants for the the neutrophils, polymononuclears. Okay, chemokines. I think they are also very active in chemotaxis and all that. Examples of the cytokines and chemokines are the nitric oxide, NO, nitric oxide. And what the nitric oxide do is that they are very, very potent vasodilators. So we have spoken about three vasodilators here. We mentioned histamine. We mentioned what? Histamine. And we said that this histamine are produced by mast cells and they are very, very strong what? Vasodilators. Then we spoke about serotonin. 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 And we said that even though serotonin has some effect on vasodilation, it is towards a lower extent, unlike histamine, which is to a very large extent a vasodilator. Now we are also looking at nitric oxide, which we are describing as what? A very potent vasodilator. Okay. And they are produced from the action of what? Nitric oxide synthesis from arginine. And we mentioned here, when we were talking about serotonin, that the serotonin causes the production of nitric oxide synthesis from what? Arginine. And it is the action of serotonin that goes to what? To initiate the production and the synthesis of what? Nitric oxide. That is why we said that serotonin is a vasodilator, but its action is what? Indirect. If you remember, we said that serotonin produced by platelet and enterochromaffin cells, it is also a vasodilation agent, but it does it indirectly, and it evokes what? This enzyme called nitric oxide synthetase, which is a ligase from arginine. And so it is the action of serotonin that will cause this enzyme, nitric oxide synthetase, to come and produce our nitric oxide for us, and which nitric oxide is a potent vasodilator. So you see how these things are related. Have you seen the relationship? Good, good. You've seen the relationship. Yeah, Gerard. Screen. I lost my screen, oh, Charlie. Hello? I can't see myself. Guys, let me create another because I can't see myself. I'm going. Okay, can you see me now? I think I'm back. I'm back live. I'm back online. Let me ask your friends out there.